Good afternoon, and welcome to the virtual town hall for November 5th. Thank you very much for joining us this afternoon. Today we'll have a number of updates. These include the transition to Microsoft 365, wellness initiatives in the medical school, and updates on HR initiatives, pediatric COVID-19 vaccinations, and care at home. Before I get to our agenda, I do want to spend a few minutes on a topic that I know is top of mind for many of you, whether you're a manager or a frontline healthcare provider, and that challenge is the challenge we face around staffing. Many of you know of and may be personally experiencing staff shortages and or difficulty with hiring and filling positions. We know that this is a hardship for many of you, and we recognize that so many of you have gone above and beyond to compensate for these gaps in our staffing over the past weeks and even months. So let me first thank you from the bottom of my heart and all of our hearts as leaders for your exceptional commitments. While this challenge is not unique to Michigan Medicine or even to the state of Michigan, it is daunting, and solving it will require creativity and persistence. In the past few weeks, Human Resources, Finance, and other key partners have been working diligently to address staff retention and recruitment and to provide more resources for HR. I won't go into detail, but I do want to highlight a few key tactics that we're implementing. For any promotions within existing career ladders that were deferred due to the pandemic, we're now fast-tracking and have submitted promotion requests. And in addition, we're expediting labor market adjustments to ensure that we remain competitive in today's climate, and we'll continue that through FY22. We recognize that the labor market is increasingly competitive in all industries, and we have to keep up, and we will. And in terms of recruitment efforts, we've authorized signing bonuses for select mission critical positions, and we've prioritized these positions in our job boards and postings. HR is also working with operational leaders and stakeholders to fill positions across the entire academic medical center. We've added HR staff, and specifically to the talent acquisition team, to help manage our escalated recruitment and retention efforts. Together, this has been an incredible effort, and I want to thank everyone in Human Resources and Dee Hunt for all of the support and leadership they have shown, and as well as the support staff who have contributed. Finally, I want to express my deep gratitude and appreciation for everyone on the front lines, in support services, and in all areas of the organization for your daily commitment and work. We're still challenged with the many ripple effects of the pandemic, but I can't thank you enough for your resilience and endurance since we first learned of COVID-19 now more than 18 months ago. I hope for, and I know that there'll be brighter days ahead. For today, as usual, we'll have time for updates to take questions, so please submit your questions in the chat box. Tony Denton joins us today and will be moderating the Q&A for this town hall. And finally, remember the mission, vision, and values that we base everything that we do around as projected. Now let me ask Michael Warden from HITS to kick off the agenda.
Thank you very much. I want to take a few minutes to talk about a change that's going to start rolling out next week regarding our move of email from our data center into the cloud as part of our migration to Exchange Online. Next slide, please. You all hopefully have seen messages, communication from your department chairs, chief department administrators, operational leadership, or some of the news headlines that we've been posting. We've also shared this on some of our screensavers, but starting next week, the majority of the organization will be moving to Outlook Online through Exchange Online. This was originally scheduled to happen over a number of months, but based on feedback from all of you, we're trying to make sure that we accelerate through this process as efficiently as possible. So we're going to be doing this migration to Exchange Online over about the next 5 weeks. Two key takeaways for today is just to make sure that this transition is being designed to be as smooth as it can be, but it can be disruptive if you're not prepared for it. So there will be messages coming from an account called Ready for Microsoft 365 or Ready for M365 to pay attention to. But everything you need to know is going to be available on the HITS website at mishmed.org/MDM. That short URL will get you to all the information you need to know when it's time to switch over your email. Next slide, please. Most of this is going to happen behind the scenes. If you're on a core image machine, or if you use the web to check your email at office.com, those things will continue to operate very smoothly while we move your data from our data center into the cloud. But one change will be how you use your mobile device. As part of moving to Exchange Online, we are now enabling you to be able to use Microsoft's Outlook mobile app and encouraging that as your primary email and calendar tool, because it's going to open up lots of features that support teamwork and modern capabilities in our Exchange Online service. To make that happen, part of your transition will be uninstalling our Intelligent Hub app that you've had on your personal devices and installing our Intune app, and then installing our Outlook app. The instructions have been distributed for this. There are videos that'll walk you through, and we are activating a ton of resources to help with phone calls, walk-up support, and virtual drop-in sessions if you happen to need any help getting through this transition. Again, that migration can be a little disruptive if you aren't prepared for it. So we really want to make sure you're paying attention to those emails from Ready from Michigan or for M365, and that you're going to and perhaps bookmarking that mishmed.org/MDM site. But I want to assure everybody, the only disruption we anticipate is if you happen to run into a little bit of an issue on your mobile device, on any device you have, you can always go to office.com and log in with your level 2 password, and all of your accounts and data will be available to you from nearly anywhere. Please do pay attention for your mobile device. We know we operate on these on a daily basis, and we want to make sure that we reduce the disruption for you. Next slide, please. Our timeline, as we said, we've been communicating pretty rapidly over the last 2 weeks to make sure that everyone in the organization is aware of what's happening. And this migration is going to happen for the 2 weeks before Thanksgiving. And then we're going to take a break the week of November 22nd, and then finish the 2 weeks of November 29th and December 6th. Throughout all of those weeks, we're going to have a team of more than 100 HATS volunteers on the phones to help make sure that people are taken care of. We're opening up our in-person Help Me Now locations in Towsley, Taubman Library, and NCRC, and we're adding a special line on our 68000 line to give you some help. But our hope is you don't need any of those, because all of the documentation and instructional videos walk you through every step. If you have any questions throughout, please go ahead and visit that mishmed.org/MDM site, and it'll tell you how to get help or share the latest information about what might be happening. But the number one tip I'd make for everybody is go to that site, mishmed.org/MDM, and you can look up exactly what week your migration is going to be happening, so you know exactly when to expect your migration to take place. Throughout it all, office.com will be your friend to make sure all of your solutions work, but please reach out to HATS or your relationship partners if you have any questions about how this is going to unfold. And we appreciate your patience as we make this migration. We're really excited to roll out Teams and additional functions once we complete this migration in the middle of December. Thank you all. I'm going to hand it here to hear about some wellness initiatives from Mary O'Rourke.
Thanks, Michael. I'll frame our programming today just by telling you very briefly some findings from both the Rackham Mental Health Course Initiative, and as well as the campus-wide mental health initiative. So it's pretty clear that both the pandemic and just the general stress associated with graduate school has led to, I think, some real mental health and wellness challenges for our students. So 40% of our graduate students report that mental health challenges impact their academic success, which is a pretty high number. And 25% of our graduate students report significant mental health problems that include major depression and anxiety. Importantly, women and underrepresented minorities experience even greater mental health challenges. So overall, I think a guiding principle both for the campus, for the Rackham Graduate School, and for us in the Office of Graduate and Postdoctoral Studies here in the medical school is that strong mental health support will promote a vibrant and successful community of trainees. Next slide, please. With this in mind, we've put together, with the support of the Dean's Office, I think a really robust mental health and wellness support programming portfolio. And this includes 2 licensed counselors on staff. These 2 staff members are available to our OGPS trainees for brief, confidential, and free consultations for up to 6 appointments a year. And this is really important because it allows us to quickly identify students that really need additional help and intervention. And I think our community has been really grateful for the opportunity with these two counselors to consult both faculty, staff, and students on additional ways we can support student wellness for both their own personal wellness, but also for their academic success. And I think it's very helpful for us in our OGPS leadership group to hear about general trends in graduate student mental health. So overall, I think our counselors have not only provided one-on-one support to our students, but also developed a number of small group programs that allow for proactive and engaged resilience training, for example, with our students. So we are really grateful, and I know our trainees are extremely grateful to the Dean's Office for this mental health and wellness support. I'll pass it over to Steve Gay.
Thank you very much, Dr. Reardon. It's my task today to speak to you a little bit about how we are caring for our medical students in this time where, as Dr. Reardon so eloquently stated, more than ever, mental health support and wellness are essential to this institution and our community to continue to thrive. Next slide, please. All of our wellness and mental health support is based in our student M Home. These are longitudinal communities for our students that allow them to know and understand students from various classes, but also to have a specific community that they can interact and relate with and grow with. Much of our doctoring and coaching for our students comes through this, their well-being, their peer support, seminars to lead to these things. Their faculty director and specific counselors and student leadership are all there to support them through these activities. Next slide, please. As a part of that, we have a significant number of peer support groups that are an integral part of our M Home community. There's near peer support with second year and third year mentees, 2 M3s paired with those students beginning in their clinical tracks. We have peer support through all of the classes with on-demand support via email and programs focused on well-being. And we have our Empower program with M1 students paired with 2 to 3 student members with multiple check-ins and activities to support their wellness. Next slide, please. In addition, we have formed a medical well-being steering committee. It's a student-led partnership with our M Home, using a very intentional and proactive approach to well-being, working towards aligning our institutional values and priorities with student needs and their experience and training. We've started by developing a stressor map for more difficult parts of our curriculum so we can better understand where we can assist there, conducting an equity analysis of well-being data to ensure we're meeting the needs of unique populations in our community. We are developing mechanisms to consult with students, conducting well-being research and programming, and we are continuing our support of our existing peer support initiatives. Next slide, please. We also have a medical student mental health program with proactive opt-out checks automatically scheduled for the students with protected time within their curriculum. We are working to remove the barriers to mental health care to allow our medical students access to psychological care and psychiatric services at no cost as a part of their enrollment here at the medical school. Next slide, please. In that, as stated, the psychological care and psychiatric services are at no cost. The psychological services will be dedicated therapists currently being hired by the Michigan Medicine Office of Counseling and Workplace Resilience, and ongoing psychiatric services through the med school managed by faculty psychiatrists that are also now at no cost to students. Next slide, please. It's now my pleasure to introduce to you Dee Hunt, who will give you our HR updates.
Thank you. There we go. Good afternoon, everyone. Next slide. I'm happy to start this presentation off with talking about congratulations. Congratulations goes out to Michigan Medicine. For the 16th year, Michigan Medicine has been honored as one of Metro Detroit's best and brightest companies to work for. What does that mean? It means for those of you who want to refer your family and friends to work here, you can use this as a recruitment strategy. Thank you for your dedication to education, to research, to patient care, and most of all, over the last 18 months to each other. That's why we're still standing. Next slide. Some additional updates include the fact that we are moving forward. At our last meeting, we provided an overview of investment support for our teams. Dr. Runges talked about that today in his opening remarks. We know that retention, recruitment, and are serious concerns for the health system, for the medical school, as well as for shared services. Together, we believe that the evolving plan that we're laying out will address our current challenges, as well as assist us in our path forward. Again, we mentioned earlier today about, Dr. Runge mentioned earlier today about the eligibility for promotions as part of our existing career ladders. Many were paused during the ERP timeframe, but we're moving forward with those promotional opportunities. Positions across Michigan Medicine are being evaluated daily and nightly for market pay adjustments. This means that certain positions will have salary adjustments made. We'll be taking a comprehensive look on a rolling basis at positions in a prioritized matter. This work will take some time to complete, and we'll be continuing this work throughout FY22. As we continue to implement new recruitment strategies to find the best and the brightest talent to join our organization, we are partnering with internal and external resources, including the department's leadership teams, as well as the Department of Communication has partnered with us to spread the news that Michigan Medicine is hiring. Currently, there are over 1,400 open positions across the organization. We're implementing sign-on bonuses for specific positions and employee referral, as I mentioned earlier, other incentives for you to help us in hiring your family, friends, and others to this great team. This work takes time. Thank you for your patience and your support as we work together to overcome these challenges and successfully support employees and our recruitment strategies to bring on additional outstanding employees to join our team. Next slide, please. With regards to our flu vaccine, we want you to remember that this month you're nearing the end of it. We're at 55%, and we have about 25 more days before we get to that deadline. All faculty, staff, learners, and volunteers who come into Michigan Medicine must receive the flu shot, submit their declination, or have an approved exemption on file by December 1st. All of this has to occur by December 1st. All exemptions should have been submitted already, and they're in the process of being reviewed. Various options are available based on what is most convenient for you. I encourage you to not wait much longer. And here's some options. You can go to your department flu liaison clinical areas, that's available. There's also the OHS clinics that you can go through on main medical campus. And that is, registrations are required for that. And then your local pharmacies, whether it's Walgreens, CVS, or Myers, PCPs can give you a flu shot, as well as the various health systems. We remind you that if you receive your flu shot outside of OHS clinic or your flu liaison, please make sure you submit your documentation to OHS by December 1st. Next slide. Service awards. I am honored to congratulate our employees for celebrating their milestones this year. So congratulations to our 2021 Service Award honorees. This is a time of the year where we celebrate the years of service, many accomplishments, the lessons learned, the medical miracles, and the unlimited discoveries that's been made by all of these individuals and yourselves. We honor and congratulate 145 staff members with 30, 40, 45, and we have one person with 50 years of employment for a total of 4,740 years of services. If this isn't your year, just hang in there. Your time is coming. We want you to stay here and be recognized for all these years. But I do take this time to thank staff member, no matter how many weeks you've been here, months that you've been here, or years that you've been here, to thank you for making a difference at Michigan Medicine. And congratulations to our honorees. Next slide. Now I'd like to introduce to talk about pediatric COVID-19 vaccine, Dr. Lorraine Washer.
Thanks, Dee. You may be aware that late Tuesday this week, the Centers for Disease Control and Prevention has recommended that children ages 5 through 11 should receive the Pfizer-BioNTech coronavirus vaccine. And this decision was in line with the Food and Drug Administration, which on Friday last week authorized emergency use of the pediatric dose. And this applies to roughly 28 million children in that age group in the United States. Before reviewing details around the vaccination recommendation, I did want to provide background on how COVID infections can and have been impacting this age group and why this group can benefit from vaccination. Next slide. Children definitely get COVID vaccine, and some of them are sick enough to be hospitalized. In fact, children ages 5 to 11 are at least as likely to be infected with SARS-CoV-2 as adults. This has resulted in more than 1.9 million cases reported in the US in this age group, and about a 38% seroprevalence, or about 38% of kids in this age group have antibodies to COVID. And now this age group is making up a greater proportion of cases, especially as other age groups have been vaccinated. Children 5 through 11 mostly have mild disease, but they are at risk of severe disease from COVID. In fact, there have been more than 8,300 hospitalizations of children in this age group across the US, and at least 94 deaths. Hospitalization rates for COVID in this age group are actually similar to influenza-associated hospitalizations in the years before the pandemic. And in addition, a condition called multisystem inflammatory syndrome that occurs on an average of about 4 weeks after COVID infection and can cause inflammation of multiple organs, including the heart, and often results in the need for ICU care, is most common in this age group of children 5 to 11 years. Next slide, please. And as a result, and because of robust safety studies, clinical trials have demonstrated 90.7% effectiveness against the COVID infection in this age group of kids, resulting in the FDA authorization on October 29th. And on November 2nd, the CDC, or Advisory Committee for Infection Prevention, on November 2nd. And this recommendation, as I said, applies to 28 million children in the United States. This vaccine is specifically packaged and formulated for this age group. It's a smaller dose, a 10 microgram dose, compared to the 30 microgram dose used in adults. And like in adults, is administered intramuscularly as a 2-week dose, as 2 doses, 3 weeks apart. I'll say that again. It's given intramuscularly as 2 doses, 3 weeks apart. The vaccine side effects in the clinical trials were mild, self-limited, and similar to side effects that we see in adults and in other vaccines for children. And importantly, this 3rd dose or a booster dose are not recommended in this age group. Next slide. So parents and guardians have many choices about where to vaccinate their children. The vaccine is already available at many local pharmacies, and soon will be available through local health departments and at Michigan Medicine locations. In fact, beginning today, the scheduling grid for pediatric appointments is open, and the first doses will be given starting on Monday. There will be mass sites to give the vaccine to the pediatric population at the NCRC, Northville Health Center, and the Brighton Health Center. And there are plans in progress to equip several general pediatric clinic locations to administer the pediatric vaccines within the clinic and within clinic appointments. And thank you. At this time, I'd like to hand over to Dr. David Miller.
Thank you, Dr. Washer. I'm going to spend a few minutes talking about our initiative of the year, Care at Home. But before I do, I want to connect our priorities and this initiative to our overall mission. If I could have the next slide, please. Our mission is to advance health to serve Michigan and the world. And as I consider this, I focus a lot on the concept of advancing health or continuous improvement in our health system, in how we do our business and how we care for patients, as well as our reach and impact both in Michigan and the world. If I could have the next slide, please. In support of this mission, we've defined together strategic priorities presented in the context of a framework of building our base and strategic growth and partnerships. The concept of building our base is based on the foundations of belonging and inclusion, access, safety and quality and experience. And then strategic growth and partnerships to support clinical care, education, and research for the academic medical center. Across the enterprise, we have priorities in each of these areas that we will work together relentlessly to achieve this fiscal year. And in so doing, we will strengthen our base, move toward operational and clinical excellence, while also growing strategically and building the foundation of partnerships that we have locally, regionally, and around the state. Could I have the next slide, please? We've chosen together to highlight one of these initiatives related to access, the A in BASE, which is our Care at Home initiative. This is our initiative of the year that will support access by developing multiple clinical pathways that allow patients to go home earlier and safely complete their care at home. We are already beginning this work with several specific patient populations being eligible, including patients with COVID, and soon patients with congestive heart failure and patients undergoing certain abdominal surgeries. Our goal for this year is that by June of 22, we will have on average 10 patients being taken care of in their home every day. Can I have the next slide, please? It's important to consider how this Care at Home program is different and how it expands the site of care for patients seen at Michigan Medicine. In particular, hospital level care at home is available for patients who might have initially been treated in the emergency department in an observation setting or as an inpatient. So there's a lot of flexibility for which patients may ultimately be able to participate in this novel care delivery model. And this is distinct from outpatient home care because it offers the ability to provide higher acuity care. It includes provider and nurse visits, remote monitoring, medical equipment, labs, mobile x-rays, and pharmacy medications. And the response across our organization has been incredible. Already, we've had at least 20 additional clinical areas reach out to ask the question about how their patient population may be able to participate in care at home as the program grows. Can I have the next slide, please? And in fact, I believe that almost everyone here at Michigan Medicine can provide support. It may not be immediate, but as this program grows, we are seeing opportunities and receiving feedback and requests to participate from across the organization, from colleagues in pharmacy and finance, our shared services, legal and government relations, social work, supply chain, providers in many other areas, reaching out saying, how can we contribute? How can we partner? How can we help advance our initiative of the year on behalf of our patients and our communities? I'm so grateful for this partnership. I'm so grateful for the creativity and expertise that is moving us forward toward our goals with our initiative of the year. Could I have the next slide, please? As we advance our Care at Home program, we'll build our base for our health system. We'll continue to pursue strategic growth and partnership in an effort to advance health for Michigan and the world. Thank you for your continued support, creativity, and leadership. I'll now transition to Tony Denton for our question and answer session.
Thank you, David, and good afternoon, everyone. Thank you for participating in this town hall. We have a number of questions we want to share with you and provide some answers. So if Dee Hunt, if you could come on, we'll have a few questions for you in HR.
I'm on, Tony.
Hi, Dee. A number of questions about promotions and reclassifications for you. The first one, though, is can you explain what a career ladder promotion means? And does that only apply to clinical positions?
No, there could be career ladders in different areas. A career ladder is, for example, you might be starting off at a level 1 position, and there is a intermediate next step, and then there is a senior position. So you will have to complete some requirements to get from level 1 to intermediate, and from intermediate to the senior level. So it's a step-like program that people will have to complete the requirements to move forward.
The next question is, can you speak to when the annual promotion and equity process will happen for non-clinical positions?
Well, it's going to depend. We have completed some priorities and we're continually looking at that list based on it. So I can't give you an exact time when it's going to happen, but as the list, we work through our prioritized list, we will go through those and get them processed.
Okay. Staying on that topic, we have several staff who deserve promotions and salary increases, but we were told that this is on hold. When will we be implementing promotions and increases? You see there's a theme here.
Yeah, merit process was already completed. And we are already started some of our adjustments. If you might remember, last year, we went to a minimum increase, minimum wage of $15. We've also processed recognition bonuses. We've also looked at, in May, we did some market adjustments, and now we're finishing those market adjustments up from the fall, starting this month. We're doing some processes, so people will start to see increases in their checks at the end of the month and in January until we get through that entire list.
Great. It's a lot of investment in people.
Yes, it is.
I'm going to shift to category D. Just a couple more, and then we'll transition. Regarding service awards, can you tell us if those include faculty, and if not, what else are we doing regarding recognition of faculty service?
Our service awards are for those in Michigan Medicine. So you will see some faculty members in there. I believe those include our faculty. I don't have a list, but I believe, if I'm correct, looking at my list, it is staff only list. It is a staff only list. So faculties would have their own separate process. I apologize for that. Took a look at the list. And it's a university policy that we're following.
Okay. This is my last question for you at this point, Dee. What percentage of the faculty staff have met the COVID vaccine requirement? And feel free to phone a friend if you need help.
My friend is not in today on my list, so we will have to get back with you on that.
All right. Thank you, Dee.
Brian, Tony, Brian Zink here. I can give you the faculty numbers if you'd like.
Oh, yes, please. Thank you.
Thanks, Brian. I didn't see you.
Yeah, so for faculty, it would appear that we are at 99% or above for faculty vaccination. We've gone through the database and we're dealing with really a handful of faculty. And there have been faculty on leaves and sabbaticals and things like that, but we're down to, again, just a handful of faculty who would not be vaccinated or exempt at this point. So there's been really great compliance among the faculty at this point.
Super. Thank you, Brian. Dr. Washer, if you could join.
Yep, I'm right here.
Thanks for your presentation. There are a number of questions for you. First one, I'm not high risk or frontline, but I got the COVID vaccine in January. Is there a time frame in which I should get the booster?
Yeah, so if you're not high risk or frontline, but you work among other healthcare workers, you certainly could qualify for getting the booster vaccine. And anytime after 6 months is the time frame when that would be advised. The booster dose is recommended for individuals who work specifically in industries such as healthcare, manufacturing, teachers, education, and it doesn't necessarily mean that you have to be frontline in patient care to have an increased risk of acquiring COVID. So if you're in a situation where you're frequently around a large number of people on a frequent basis, it still may be reasonable for you to get a booster dose.
A follow-up question, is the booster like the flu shot, and should it be done annually, or do we know?
Yeah, right now, the booster is a one-time booster dose, and there is no recommendation for annual dosing. But at the same time, we don't really know what the future may hold with regards to longevity of that booster dose and or what types of modifications or variants we might see of COVID in the future. But right now, there's not a recommendation for an annual dose.
Okay. Pediatric COVID vaccine question. There's a note that these are in Ann Arbor, Northfield, and Brighton. And the questioner is wondering if there's a plan for our patients in Ypsilanti and Eastern Washtenaw County who may face barriers to accessing the other clinics.
Yeah, so I would ask Crystal from Ambulatory Care to comment upon that.
Hi, Dr. Washer. Yes. So yes, there is a plan to activate pediatric vaccinations at Ypsilanti, as well as we are in discussions with several other clinics to actually have that available as well.
Great. How long does a 5 to 11-year-old need to wait after contracting COVID to start getting the vaccine?
The recommendations for the 5 to 11-year-olds who had COVID are the same as those we see for older children or adults, which is really a minimum of 10 days after diagnosis or symptom onset. And also would like to see the symptoms resolving and certainly be fever-free.
Thank you. It's my understanding that a child has a better chance of getting myocarditis with the vaccine versus not getting the vaccine. Is this true? Do we know?
Yeah, I think there's data on adolescents and myocarditis, which is that male adolescents in particular with the mRNA vaccines, sort of that 12 to maybe 20-year-olds have a risk of myocarditis. But the risk of myocarditis with infection with COVID outweighs the risk is greater than the risk from myocarditis from the vaccine. For children, I think there's less known about that. There were no myocarditis cases seen in the clinical trials of vaccinated children ages 5 to 11. But the numbers were much smaller than the number of adolescents that we've seen vaccinated since the introduction of the vaccine for 12 and up.
Thank you. Here's a Pfizer specific question. Lorraine, can you tell us more about the buffer that is said to be used in the Pfizer pediatric vaccine? And
yeah, so there are a number of differences to the Pfizer pediatric vaccine, and one is the dose, which is about a third of the dose of the adult and adolescent vaccine. They use smaller needles to administer for smaller kids, and also the buffer is different. And the reason is that the company chose using a different buffer because it helps keep the vaccine more stable in the refrigerator, so it can be stored for a longer period of time. And this buffer is used in other FDA-approved vaccines.
are there any safety concerns?
Yeah, I don't believe there are safety concerns. As I said, it's used in other FDA-approved vaccines. I will say that I'm not an expert in the buffers used in vaccines. I think our pharmacy experts may have more to say on that.
Okay, Thank you.
Great, thanks.
Dr. Miller, I have a question for you.
Thanks, Tony. I'm here.
A care at home question. Are there only certain geographic areas that qualify for care at home?
That's a great question. Thank you. Right now, it is a limited geographic area, predominantly in Washtenaw County and extending out just in a short region beyond Washtenaw County in some areas. That reflects a number of considerations, including, the ability to provide care at a distance in the home in those settings. Over time, we see potential opportunities through partnership to expand that, but right now there are some geographic limitations to the program.
Okay, thank you. As long as I have you, David, and Dee, you might come back as well. Have a question related to all COVID vaccine mandates per the White House announcement. Are there any changes expected as a result?
Thanks.
Go ahead, David. Dr. Miller.
No, please, Dee, go ahead. I can follow your answer.
Yeah, as before, we're still analyzing the federal guidelines to determine whether this announcement will change our direction with employees and are subject to the mandate. So we're still going through that process. It just came out and we want to make sure we understand it completely.
Okay.
Thanks, and I agree with Dee's response.
Thank you. There's some new questions that have just come in. I think for you, Dee. Thank you, David.
Yes, I'm here, Tony.
Regarding service awards, are we doing anything for staff who didn't receive a service award due to the economic recovery? I had an employee with 45 years of service, and I want to be sure that they are recognized with a service award officially. So how did we handle last year during the
last year,
pandemic?
from a university's perspective, gifts are going to be given out. So they'll be getting information on that. We are going retroactively to go back and recognize those individuals. We did have the online service awards events, but they did not get gifts. So we are in the process of doing that now.
Thank you, Dee.
Mhm.
Lorraine, could you rejoin us for one other question here that's come in here? Should those of us who are vaccinated and had a breakthrough case still get a booster?
Yeah, there's the number of questions around the permutations of what can happen certainly have changed, but yes, I think particularly if you're in a high-risk category, such as age greater than 65 or underlying medical conditions, a booster, we know that the booster doses and the vaccine doses have a very broad and robust antibody response. And so I personally would recommend that you get a booster. I think it's an important question, and it may be one that you want to speak more directly to your physician about, or if you have specific questions, I'm happy to counsel you offline. Thanks.
And this is a new question here. Can you comment on the new pill that's been made available from Pfizer to treat COVID?
Yeah, I think there are two antiviral medications, which are oral formulations that are being evaluated. One, I believe, is from Merck and was approved in the UK just recently. And I believe Merck has requested FDA approval for that. And it has been associated in the clinical studies with decreased risk of progression to severe disease that might require hospitalization. The Pfizer drug, I think, has just recently released data with pretty good outcomes, doing the same thing, treatment of mild to moderate disease and prevention of more severe disease. That I don't think yet has been applied. I don't think they've applied to the FDA for that. So none of these are available for use in the United States yet, but hopefully will become good tools in our treatment armamentarium.
Thank you. Please stay on for a moment. I really appreciate all the participation. The questions are coming in fast and furious, so we want to try to answer as many as we can. Dana Havers, can you join for this question? I'm projecting that we're going to need a
Hey,
friend here.
Tony. Yep, I'm
Hi.
here.
Hi. Is there a mechanism in place that allows us to upload documentation of our COVID-19 booster vaccines?
Oh, that is a good question for my friend Tom Mann. So I will have to defer. I'm not sure.
Okay. All
I'm
right.
sorry. Yeah.
Well, that's okay. We'll follow up, and we will commit that to documentation following this town hall. Thank you, Dana and Lorraine. Dee, can you come back, please?
Come on, Tony.
Thank you. There are a number of follow-up questions here related to the CMS vaccine requirement. You've referenced where we are at this point, so I will ask the question and you can see what the appropriate response is at this point in time. What are the implications or changes related to the new CMS vaccine requirement and timing for those who have been allowed to test in lieu of vaccination?
Yeah, I think we're going to go back to my original answer with regards to waiting to see. Our Office of General Counsel is working with us and analyzing all the data for all the different pieces of our policies and procedures. So unfortunately, I can't answer that question at this time.
Okay. Thank you very much, Dee. I think that those are all of the HR questions for now. I do want to make a point that for the Outlook migration conversation, please go to mishmed.org/MDM if you have any questions related to the talk presented by Michael Wharton. Any other questions that we weren't able to get to, we will certainly follow up with more detailed answers. So please watch for those. This has just been fantastic participation. I thank you so much. I do want to share a bit of a reflection. I'm thinking about Dr. Runge's earlier comments about resilience and endurance in our values and the service awards. It all kind of goes together when you think about over 4,000 years of service for those who are being recognized, and put it in the context of legacy. A legacy defined as the mark that we leave on the world. And I think it's the richness of life, healing, the recovery, the restoration of health, prevention, learning, the discovery that we do at Michigan Medicine, that it's really important to think about that, for me anyway, during November, where we embrace Thanksgiving. We pursue excellence each day to make the world around us better. Our accomplishments and burdens, shared as they might be, I think are the rich fabric of the Michigan Medicine legacy. The legacy that started 171 years ago when we opened up the doors to the medical school, 152 years ago when we opened up the University of Michigan Hospital, the first one. And we're still here, still standing strong, being better at our collective mission, laying a strong foundation for generations to come. So I just want to share with all of you how thankful I am for all of you, for our collaboration, our teamwork, and as Dr. Runge stressed, our resilience. So wishing you a happy Thanksgiving and thanking you for participating. Go Blue, beat IU. Thank you all. Have a great weekend.